My name is Lyle Murphy. I'm the founder of the Alternative to Med Center, a place where we help people reduce and or eliminate their needs for psychiatric medication and rely more on holistic measures. Today, we're going to be talking about medications that may be making you sick. The first question that I have is, can my medication actually make me sick? So one of the common colloquialisms in the term side effects is to believe that side effects of medications are something that were not intended. Well, the news is that the effects and the side effects are all the effects of the medication. So, especially with psychiatric medications, the neurochemicals that are being acted upon with these medications are not solely limited to what happens in here. You have neurochemicals all throughout your body and especially in your digestive system. So when you start tweaking that, it affects the way things are happening in your gut. So for instance, there's usually an inverse relationship between your sympathetic nervous system and your parasympathetic or your autonomic system. So a neurochemical that has an excitatory effect in your brain actually has a sedating effect in your gut, so that you're not stimulating both at the same time. So when you're altering these neurochemicals for the brain, you're definitely playing with the same neurochemicals for your gut, and you may feel digestive insult from that. Next question, what happens if I take more than the recommended dose of my medication? Well, that certainly depends on the type of medication. If someone, let's say, is supposed to take a milligram of Ativan in the morning and a milligram of Ativan at night, and instead they take 0.5 milligrams in the morning and 1.5 at night, then that's not generally a problem. They're still taking the same total overall dose. They're just probably leveraging it because they want to use it more as a sleep agent and are not so worried about daytime anxiety. If a person is taking significantly more than the recommended dose of medication, which happens a lot, especially with the benzodiazepines, then they're probably on a slippery slope towards addiction, or they've basically downregulated to the effect of that medication, and they need to talk to their prescriber about a different medication or exactly what's happening, because the problem is they can end up running out of medications at the end of the month, and then they have a real problem. Again, it depends on what type of medication you're taking. If you're taking more of lithium, let's say, than you're supposed to, that could be a real problem. Lithium could be neurotoxic at certain levels. So it's usually not the type of medication people are going to go over and above on. If you've significantly taken more medication than you were supposed to, let's say, for instance, you thought that it said 1 milligram, or you thought it said 10 milligrams, but it actually said 1.0 milligrams. So you ended up taking 10 of something you're only supposed to take 1 of, like a benzo, then that might be a situation where you might want to purge, or you might want to call some urgent care services. Next question, what if I take my meds more often than the doctor said to? Well, honestly, this is quite common. And again, the problem with that, the biggest problem with that is usually the prescription is for a certain amount of time. So if you get a 1-month prescription for something like Xanax, and you've taken all of it within the first 2 weeks, you are not going to have enough to last that other 2 weeks, and it's going to be, of course, a crisis situation. If you're taking, like in other situations, maybe your normal prescription might say take 1 milligram as needed, and it's a benzo, then you take 1.5 milligrams because you're having a super moment where you need more of your medication than maybe, and you're, I trust people in some levels to be their own guide on these kind of things. Like if you took a little bit more medication because you're having a truly impactful moment, maybe that's appropriate for you. These are all the type of things you really want to talk to your doctor about and get their feedback on. But it's how you take your medication, honestly, is really a relationship between you and you. But obviously, your prescriber is the one prescribing it and needs to know what you're doing and what you're not doing so that they also feel safe prescribing what they're prescribing. So some of these conversations with your doctor are the best place to go. And if you don't feel like you can trust your doctor with these type of conversations, then get a different doctor. I know it's hard right now, especially with a lot of the restrictions that are happening because of COVID, to actually find a practitioner you can go into their office. But there are a couple websites that I would suggest. One is called the IMMH. They're an integrative mental health platform that has providers that are listed on their database. It's immh.org, and you can go on there and hopefully find a provider in your area that has a bit of an integrative and open mind approach to the way they prescribe. And another organization is called ACAM. It's the American College for Advancement in Medicine. Their website is acam.org. And again, you put in your zip code. You really don't need to fill out the other fields. Just put in the zip code, how far you're willing to travel to see a doctor, and you'll start getting a list of practitioners, hopefully if you live within reasonable distance of an urban area. And those doctors, by and large, are more compassionate and open-minded and are flexible around the drug approach and may be able to hear you in a way that your practitioner, if you have one that's not listening to you, can't. Next question, what should I do if I miss a medication dose? Again, this question is really specific based upon what the medication was. So if you missed your benzodiazepine dose, should you take 2 of them to make up? No. You just would, like, let's say I was supposed to take one at noon and I didn't take it, and I had one scheduled for the evening, then I would just take one in the evening. If that noon dose was your only dose you were supposed to take and you missed it, then you could just theoretically take that dose later. In most situations, you don't want to take the medication twice if you missed a dose, but then there are those types of situations where you do. So let's say you were supposed to take an antipsychotic and you missed it that night, and you were supposed to take it that night and you forgot. You may be taking that medication in the morning because now you remembered you're supposed to take it, and you also might be taking it at night. So I can't tell you as a non-prescriber how to adjust your medication dosages. These are always things you really need to run by your prescriber as far as like the true legal way to be told what you can or cannot do with your medications. I'm just giving you some talking points that you might run by your prescriber, and like, what should I do in this, and just kind of expand the conversation a bit for you. But in other situations, like let's say maybe you missed your 15 milligrams of Zyprexa at night, and now it's the next morning. Maybe that morning you would take half of that dose, 7.5 milligrams, and then follow up in the evening with your normal 15 milligram dose, because maybe you don't want to be that sedated during the day and you have to go to work. So those are the type of conversations and the starting point you'd have with your doctor when talking about your specific medication, which is going to be very different than a general conversation about medications. Just what happens if I miss a quote medication dose. That is a bit of a broad topic to try to answer. It has to really be narrowed down to the type of medication that you're on and how that dosing should be made up for. Next question. If my medication says must be taken with food, what happens if I don't? So usually why they say to take the medication with food is because that medication is probably a stomach or gastrointestinal irritant. So if you take it without food, it's going to irritate the lining of your stomach. And sometimes even a modest amount of food, like a bit of milk or just a piece of toast or something, is enough. Maybe not the best food choices, milk or piece of toast. I mean, maybe go for an organic smoothie or something. But it just gives enough of a coating to the stomach itself so that the drug itself is not having such an irritative effect on the gut lining. Next question. Do I have to take my medications on an empty stomach? Well, if the the recommendation for the medication is to take it on an empty stomach. You should probably follow that. There are certain medications, especially synthroid medications, thyroid medications, that's pretty important for. The reason why you take it on an empty stomach is because for that particular medication, it says that is because it helps with absorption. So if you eat and take that medication at the same time, you're going to be, to that degree, reducing the effectiveness of the medication. So what does an empty stomach mean? It means 1 to 2 hours before eating or up to 2 hours after eating. So there's at least a 3 to 4 hour window that you have to work around in between your meals. Next question, are there foods I should avoid eating before taking my prescription? Again, it depends on the prescription. So one of the most common offenders that affects especially the psychiatric medications is grapefruit juice or grapefruit. There are foods that act as certain enzyme inhibitors. And that particular one inhibits the CYP3A4, which is an enzyme that helps break down a lot of these psychiatric medications. So in most cases, the effect is it actually takes longer for that medication to metabolize out of your body, so it strengthens the effect. In other cases, it may be that the metabolite of that medication is the active compound that's going to have the effect, and so it inhibits the effectiveness of the medication. So grapefruit juice is one of the ones that shows up the most. For like potassium balance, licorice can actually affect certain diuretics. Alcohol is not good with certain medications, particularly any type of sedative. You don't want to be taking 2 sedatives at the same time. So if you're taking some sort of opiate or some sort of benzodiazepine, it's going to make a mess out of things if you start drinking with that. But also, the SSRIs don't go that well with alcohol. We'll get into that in a little bit. Caffeine. Honestly, there are foods that may have led you to being medicated in the first place. One of the most common themes that we get for people with mental health problems is truly a bad diet. And when we correct that diet, the mental health problems alleviate. It is this sort of overplayed adage that, you want to eat right for your mental health, but nobody really gets into the actual mechanics of what that really means. So a lot of times in our videos, we do get very granular on those sorts of things and get very scientific about it all. But by and large, if you're consuming products that are forcing a stimulatory or sedative effect on your system, there is a bit of a roller coaster ride that sets up. Caffeine, for instance, affects your blood sugar, and you basically dump a bunch of sugar. Your body tries to mop it up with insulin. You go down below the baseline of what your fasting blood sugar would be, and you're in this zone called reactive hypoglycemia, which can cause a lot of mental health symptoms, especially if you tandem that with some sort of spiritual, psychological, or emotional crisis. It can just sort of like crescendo it. And many times the reason why people end up in psychiatric care is because they're having a low blood sugar event combined with some other sort of stressor. We did, when we first started and we were looking for reasons why people were ending up on psychiatric medications and how to help it, back 17 years ago, our first 200 patients, we did a glucose tolerance test. It was a very arduous test for us to do. It involves getting a fasting blood sugar and then drinking a very syrupy, high concentrated, sugar concentrated liquid, and then plotting the blood sugar over the next 5 hours. The test itself was very hard on the system, but what it revealed is that over 74% of the people had this reactive hypoglycemia problem, and in combination with their history and asking them why they went to the hospital, it was very often reported that their diet was not sufficient in those moments. So unstable blood sugar can be part of why a person has mental health. So eating organic, eating a breakfast that has actual protein content, whether that's vegan or carnivore diet, staying away from just processed foods in general. If something has a label on it and they're trying to sell that to you through a commercial, guess what? That probably is not good for you. I've personally never seen like a blueberry billboard, like things that are actually good for you generally don't have the same promotion as things that are bad. I mean, like Doritos, for instance. If you took that food and you eliminated all of the things they've done to trick your psyche into thinking that tastes good, which is adding some sort of sweet, sour, salty, fat sort of thing to it to actually trick the receptors of your tongue to go, oh, that's nice, I need that. That stale dead food would taste so bad you'd spit it out faster than you'd, never mind, but pretty quick. And this is how they've crafted food to be very addictive and for you to think, oh, that's good. Well, another thing we've been tricked into, especially culturally, is food combining. When you combine a simple carbohydrate that takes maybe an hour to digest, and you combine that with a fat that takes 4 to 8 hours to digest, what happens is you get fermentation and expansion in your gut. Now, that does produce a very tranquilizing effect and makes you feel like you've, had something rewarding out of your meal. But on a physiological level, it's challenging you and your mental health. It's breaking down your ability to produce endorphins and other neurochemicals. And inflammation is one of the biggest killers, not just physically, but also mentally. So brainstem inflammation and things like that can be important. And there's a food combining. It's kind of like how a washing machine works. You combine colors with light colors and whites with you put bleach on them. But you don't mix all that together in the same washing machine and expect the washing machine to figure it out. You should have figured that out before you put it into the washing machine, right? Because the washing machine just does what a washing machine does. Well, your gut's the same way. We treat our gut like, well, it's going to figure everything out. We just stuff down in it. Well, guess what? There's enzymes that break down things at certain pH levels. There's enzymes that work in certain capacities to get the nutrients that you need out of proteins, the nutrients that you need out of fats and everything. And if you just throw everything in there in some madness, it can't figure it out for you. And it's not, and there's going to be ramifications for that. And a lot of times those are mental. So cleaning up your diet in general is a good way to maybe avert some of the complications of even being on medications in the first place. Another thing is food allergies. Some people are allergic to certain foods. And how do you know what that food is? Well, oftentimes people report it's the food they can't live without. Isolating these food allergies and eliminating food allergies that are unique to you, maybe not to me or another person, but to you, can be best achieved through a food allergy test. A naturopath can do these type of tests for you and help dial in the type of diet that's right for you. And maybe if you do that, then the medications may be less crucial to keeping you balanced. Next question. Is it okay if I drink alcohol and take my prescription medications? Well, some people, that's how they live life, but it's not a good way to live life. So as we mentioned before, the SSRIs particularly, like alcohol itself is like, it's kind of a setup for depression. It gives you this alleviating effect, but it's spending something. It's spending certain neurochemicals, and it's also whacking your blood sugar in a certain way because it is a liquid sugar. You go up and then you come back down. And that roller coaster ride is not sustainable to live life with. So then when you combine that with antidepressants, you're actually worsening, potentially worsening the reason why you ended up on antidepressants in the first place. But the combination of the two can lead to more gastrointestinal bleeding, and that obviously could be a problem. Mixing alcohol with aspirin can have the same effect. And there is actually a warning about mixing antidepressants with alcohol for that reason. Next question. Do I have to stop eating certain foods because of my prescription meds? Well, as we mentioned, things like the antidepressants and alcohol, the grapefruit thing is probably something that is going to be weird on a lot of medications. And also grapefruit can even affect the calcium channel blockers and the statins and things like that. And I actually pumped out a list here. Let's see if I can go through the important ones. Benzodiazepines They don't mix well with caffeine just because they have an antagonistic effect to each other. One's trying to sedate you and one's trying to elevate you. Most people that are taking benzodiazepines and also have anxiety, they know that caffeine is going to send them through the roof. Valium and grapefruit juice, it increases the level of the drug, so you actually get more of a drug effect because of the grapefruit juice. Let's see, lithium. The sodium and the lithium have an inverse relationship, so high sodium can actually affect the way your lithium is working. Grapefruit juice shows up for a lot of the medications. The next question is, can my prescription medications cancel each other out? Yes, absolutely. And the most disturbing thing for me is that oftentimes these type of canceling out prescriptions is encouraged by the prescriber. So, for instance, let's say someone had a manic episode and they ended up on Abilify, and then or some other antipsychotic even, and then the person says, "Well, doc, I'm too sedated. I feel like I can't hardly function." Well, the natural conclusion, I would think, would be to, well, then let's reduce the amount of that medication and see if we can't find the sweet spot. Now, of course, considering what I do, let's figure out a way to get off the medication entirely. But as a prescriber, I would think the mindset would be, let's back down on the medication a little bit. But instead, what they do is oftentimes add some sort of stimulant. They say, well, let's take Wellbutrin, or let's take Vyvanse, or let's take something that's going to shoot it in the other way. And to me, that makes about as much sense as trying to stand a broomstick up in the middle of a hurricane. And it's just like you hope you can kind of poison the thing in a different direction so the broomstick actually stays upright. Or another example might be you have someone that you want to park your car in the garage, and you have to go up a little bit and get it into the garage, and so you use the accelerator and then the brake a little bit. But by adding two different medications, one that increases dopamine and one that decreases dopamine, it's like trying to park that same car by slamming as hard as you can on the accelerator and the brake at the same time and hoping the car flips in there sideways and manages to park itself without doing any damage. You wouldn't want somebody parking your car like that, right? So why would you want somebody prescribing in the same sort of cavalier fashion? There was a doctor way back when in our Greek times that is known for the Hippocratic Oath. His name is Dr. Hippocrates. And the way that he prescribed was in opposites. Like, for instance, if someone was too anxious, he would prescribe rest. Then if someone was too lethargic, he would prescribe activity. So it was like a little bit of a teeter-totter. Well, these medications are oftentimes like a teeter-totter. So if you've got something that is sedating you, let's say it's you're taking trazodone and you're taking Ambien and you're taking antipsychotic like Zyprexa. Those are all in the same sedating sort of thing. So you wouldn't want to combine something with that was stimulatory like Wellbutrin or Effexor, because it wouldn't make sense how you're trying to balance things out. You would just, if you needed to be more stimulated, you just reduce one of the medications that's sedating you. So oftentimes I see medication prescribing like trying to create the right sort of balance with the teeter-totter, besides putting two large people on each side of the teeter-totter and hoping it like balances out that way. So if the medication is sedating you and you're taking another medication that's stimulating you, that's one way to cancel the effectiveness of the medication out. All right, next question. Is it okay to mix prescription medications and over-the-counter drugs? This is such a hard thing to answer and just without, real specifics. The cold medications come up a lot. Again, like if you're taking something that is already sedating you, like an opiate or a benzo, and then you take an over-the-counter drug that's Theraflu or something that helps you sleep at night, that could over-sedate you to the point where it could be a problem. But the best way probably to figure all this out, there is a resource online called Medscape. That's MEDSCAPE. And you want to put in drug interaction checker. So basically on the website, there's a place where you can put over-the-counter thing A, and then it gives you another open slot to put what type of drug you're on, and it'll show you the potential interactions in those drugs. And I think that's probably the best way to dial it down to your particular situation. Next question, can I take herbal supplements with my medications? Again, another very broad answer. Sometimes the answer is yes. Sometimes they actually complement each other very well. And other times there may be some interactions. Sometimes even some significant interactions. I think sometimes, a lot of times, these herbal drug interactions get a lot of buzz. Is like, oh my God, don't do that. And it's a little bit unfair. It's a little bit prejudiced. The majority of interactions I see with people actually are the medications that are prescribed by the prescriber that don't go well together. In fact, my graduate thesis in college was about iatrogenic fatalities. Iatrogenic meaning there was something that the doctor did that caused their patient to die. Not that they couldn't save their patient that was already, let's say, dying, but something that was truly attributable to the doctor was the cause of death. And it came out to 250,000 deaths per year, which would make that the third leading cause of death, would be going to see a doctor. And 85% of those were actually had to do with adverse drug reactions. So there's probably the place to look first. A lot of times these medications are being prescribed that don't go well together, or maybe the patient's not getting checked in with well enough to how they respond to that medication, or they're not being eased into that medication in a way that sort of limits or reduces the possibility of a bad reaction. For instance, if you're being prescribed a drug that is known to have certain consequences, and you're still, okay, let's take the drug, maybe start off with just the lowest dose and see how you're doing with that, and then move your way up when you are assured that it's well tolerated. But again, also on that website, the Medscape Drug Interaction Checker, they also have a convenient spot there for herbal remedies. So I looked up a common one called St. John's wort and its interactions with antidepressants that reuptake serotonin. And since they both reuptake serotonin, it could be a problem when you're getting too much serotonin. Tryptophan is another one. When you combine it with an SS or S, any type of serotonin reuptake drug, you may be reuptaking too much serotonin. Not that the St. John's wort itself is bad or that the tryptophan is bad. They're actually great things. However, when you mix them with a drug that's doing the same thing, it could have problems. So I think the best thing, again, is to go to that website and see if your particular interactions are listed there. And it's quite a robust resource for those. Okay, last question. Is it okay to smoke weed while I'm on my prescription medication? And by and large, I think people are pretty stubborn on this issue. They're going to do what they're going to do anyway. But I do want to bring up something that is I think very important. So after having done this for 17 years, speaking with people who are in mental health crises, and having documented 25,000 different phone calls, the thing that comes up the most out of thousands and thousands of different representations in different scenarios is marijuana-induced psychosis. Now, I'm not saying marijuana produces psychosis in everyone, but there are certain genetic polymorphisms where a person can't break down those cannabinoids, and they don't have the enzyme actually to break down this fat-soluble compound. And a fat-soluble compound is not going to leave your system all on its own. It has to be biotransformed in order to be taken out through the kidneys. So if you can't break it down, it builds up to psychogenic levels. It doesn't matter whether you're a frail small person or you're a highly fit soldier. It's going to happen the same way in people that don't have the genetics for this. And enough marijuana, enough THC will make a person psychotic. They've even used this in chemical warfare trials where they've sprayed 100% THC on an opposing army and shown that they can't fight because they can't function. And not just function because they're stoned, but not function because they're incredibly psychotic. So if you're smoking marijuana and you're on an antipsychotic, there's a high likelihood the reason why you're on an antipsychotic is because you're smoking weed. So you probably would want to consider, especially if you don't like the effects of the medication, which not very many people say, hey, I really love how my antipsychotic is doing with me. You may want to consider, really consider stopping smoking pot. Is it really worth it, the effect you're getting off of marijuana, to endure being on a lifetime of antipsychotic medications? And some people's retort to that is, well, I like the marijuana because it sedates me. Okay, there is a front-end effect to how you're feeling it. But the back-end effect is this bioaccumulation of THC to psychogenic levels that is creating the situation where you're ending up psychotic and needing to be in the hospital. So find other ways to kind of calm yourself down. Chamomile tea, some kava kava, or maybe just use CBD. CBD is actually more of an antipsychotic. It's probably in the plant to create a ratio between the THC and the CBD so that when a deer eats it, the deer doesn't go crazy. It's more full spectrum. But the way things have been augmented and hybridized nowadays, they're giving it more towards the THC level and losing that counterbalance of the CBD. So if you like the sedating effect, you like how it calms you, likes how you feel more creative, then maybe experiment with things that have a much higher CBD content and no THC levels at all. And that ends the questions that we had on the topic. I really appreciate you hanging with me through the whole conversation, and have a great day or evening. Thank you.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.